Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about some of the more common injuries for basketball players. But before I continue, please hit that subscribe button below. So essentially I want to keep with my theme of talking about some of the more sports specific injuries that we'll see for other sports. So I've done a mixed for hockey players, and I wanted to do another one about for basketball players. And so essentially today I wanted to talk about some of the more common injuries that we would see in the clinic here. So I want to sort of start from the ground up. And so again, one of the most common ones that we'll see are ankle sprains, and this is a pretty obvious one for basketball players. So essentially going up for rebounds or shooting and then coming down on somebody's foot and basically rolling the ankle. And so with these ankle sprains, essentially what it is, it's an injury to a ligament, and ligaments, what they do is they attach bone to bone. And again, a very common injury for basketball players. Moving up, we'll also see quite a few different knee injuries. And so, for example, that could look like, if it's more of a traumatic injury, that could look like an ACL injury. And what I'm referring to, that is the anterior cruciate ligament, which essentially prevents hyperextension of the knee. So every year in the NBA, you'll see a couple basketball players fully tear this ligament, and it's a pretty extensive rehab, unfortunately, with an ACL tear, a full tear. So typically it's first it would be a surgical route, and then typically 9 months to a year of rehab. So it can be a pretty significant type injury. Another common knee injury, again more of a traumatic injury, would be a meniscus injury. So the meniscus essentially is, think of it like a shock absorber. It's padding between the tibia and the femur. And a lot of times with this particular injury, there'll be a quick plant and twist. So again, you can think about with basketball, directional changes, cuts, potentially that would injure this area. And then finally, in terms of the knee, an injury that's not so much traumatic, but more of a muscular imbalance is something called patellar tendonitis. And so another name for this actually is jumper's knee. So again, makes sense that it would go with the sport of basketball. And essentially what this is due to is an overuse of the quadricep muscle, right? And so as that muscle becomes really, really tight, it will actually pull on this patellar tendon. So the patellar tendon, tendons attach muscle to bone, and this particular tendon, it actually runs from the kneecap down to the upper portion of your tibia bone. And so again, this is an overuse type of injury. It's a muscle imbalance type of injury. Very, very common in basketball. Another area that can be irritated again is in terms of the hip, would be bursitis, which you'll see sometimes with basketball players. Maybe not quite as common as some of these knee and ankle injuries, but again, it's an overuse type of injury of a bursa that's on the side of the hip. And then moving on up, you'll see, and I've seen quite a few injuries of the fingers, right? So again, if somebody, let's say, passes the ball and it gets hit off of the finger, that's quite a common injury, whether it's a sprain. So again, thinking about it from the standpoint of ligaments getting injured, you can get different sprains within the fingers as a result of a ball off of the finger. I've had certain conditions called mallet finger, where an actual ligament off the end of the finger was completely torn. And so again, with fingers, you'll see that sometimes you'll see a fracture as a result of this. So very common, right? Passing the ball, rebounds, getting hit off of the finger. So I hope this gave you a nice little overview, right, of some of the injuries for basketball players. And again, this is sort of an introductory video for my playlist on injuries for basketball players. Again, if you have any questions or concerns, feel free to leave a comment below. Please check with a physiotherapist or a doctor to make sure that any of this information is appropriate for you. And thanks again for watching. Have a great day. Take care.